Well, the impetus for me going to an eye care professional stemmed from a morning wake up where I woke up and there were blotches in front of my eyes. It looked like a Rorschach test, like, ink blots, and it scared the living daylights out of me. I mean, I thought I was going to go blind. I freaked out. I mean, the idea of being blind is just, it's a totality, if you know what I mean. And when I experienced that morning, I was, like I said, horrified. But more than that, I didn't know if it was fixable. When I was younger, I remember seeing horror movies, and one of the horror movies, they would put things in people's eyes, like pins or needles or whatever. And now I'm actually going to have to get a needle into my eye. And not only do I have to get it, but it's going to have to be every single month. It's not something you look forward to. I like to do things with my life. And what I don't put on my list is, gee, I really want to go to the doctor. I would have to come to the eye doctor every 2 weeks or 4 weeks or so, depending on how bad the condition was at the time. They do the scans and they see what happens and they tell you when they want you to come back.
Persistent DME is fluid that persists on exam or OCT testing in spite of multiple prior treatments for diabetic macular edema, such as monthly anti-VEGF injections or recommended prior treatments that don't happen because of missed appointments or other reasons. In these cases, I think these patients would benefit from a continuous microdose therapy such as Iluvien because it continues to release fluocinolone acetonide over up to a 3-year period, which allows a therapy for the patient even if they're missing their appointment due to hospitalizations, dialysis, or if there's a snowstorm and weather prevents them from coming in. These are the type of patients that are very common among my DME population that would certainly benefit from Iluvien.
When Dr. Kiernan told me about the possibility of this injection and what it does, in a sense like a seed that's planted into your eye that releases the drug over time, something that I would run to, and that's what I did. I'm an avid reader, that would be cut out. I'm an avid fisherman, that might be cut out. Certainly can't drive anywhere. The ability to take care of myself on a regular basis, to go up and down stairs, to do laundry, to cook a meal, would be not only greatly diminished, probably eliminated. That is a lifestyle change that I don't think anyone can grasp. Just a horrible idea, and I would do anything I could to avoid it. Since then, with the Iluvien, I've had to go, every few months, every 2-3 months, I go in, get a checkup, see what the scan says. If the edema is still in control, I go on my merry way. The difference that the Iluvien has made in my life is that it's been 1.5 years since I've had to have an injection. I'm glad the Iluvien is given to me.
Indication: Iluvien, fluocinolone acetonide intravitreal implant, 0.19 milligrams, is indicated for the treatment of diabetic macular edema, DME, in patients who have been previously treated with a course of corticosteroids and did not have a clinically significant rise in intraocular pressure. Contraindications: Iluvien is contraindicated in patients with active or suspected ocular or periocular infections, including most viral diseases of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Iluvien is contraindicated in patients with glaucoma who have cup-to-disc ratios of greater than 0.8. Iluvien is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injections, including those with Iluvien, have been associated with endophthalmitis, eye inflammation, increased intraocular pressure, and retinal detachments. Patients should be monitored following the intravitreal injection. Use of corticosteroids, including Iluvien, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections, due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development, Iluvien 82%, sham 50%, and intraocular pressure elevation of greater than or equal to 10 millimeters of mercury, Iluvien 34%, sham 10%.